Hi, everybody. Welcome back to the Hooten Family Healing Center for your Hope Dealer podcast. Recently awarded greatest double shot adjustment ever, where we adjusted a baby, and this is no joke. We adjusted a baby that was constipated for 10 days. The baby starts pooping, takes him home, and his uncle starts pooping, and he's been pooping ever since. It's been fantastic. Great show ahead of you right now. We're going to get heavy into asthma and breathing problems, cholesterol, and some joint pain. I'm going to talk about that at first and give you some real action steps. Then we're going to get in with future Dr. Bryce Maxwell, where he's going to lay it on me thick and really hit me with some hard questions and see where this discussion takes us. I love these kind of shows. I had asthma. I had this worst kind of asthma where I would get pneumonia, I would get sick all the time. So I was on 5 medications when I was a baby. And that sent me to the hospital some 40 to 50 times before I was 10 years old. So a lot of you have kids out there. A lot of you may have been through stuff like that. You know, when your kids get sick, everybody panics. Go to the doctor. Here's your drug, here's your drug, here's your drug. And eventually, all these medications started having other effects on my body, which they actually warned us. And I remember something about this. I must have been 8 or 9 years old when they told me, with this disease you have called Goodpasture's, eventually you're going to have kidney problems and you're going to lose your kidneys. So I didn't really understand what all that meant other than I was having trouble finishing soccer games and baseball games. So at 13, this kidney shuts down on the soccer field and it is like swelled up in there, whatever it was going through. And I remember this pain. It was the first pain I ever had. So it felt like somebody actually shot through me right there. It was horrible. So if you've had some bad pain before, I can sympathize. Well, now we're going to the kidney doctor, and we're waiting for one of these big appointments when my parents, they were having to give me muscle relaxers for this pain, so they took me to this chiropractor that we met on the sidewalk of Kmart. And they have the greatest last name in history, Longnecker. So we go to Dr. Sandy Longnecker, who adjusts me, and I was breathing better instantly. Not 5 days from then. Like, as soon as she adjusted me, that second I could take a full breath for the first time that I could remember. It was wildly euphoric to the point where I remember that moment, and it'll be in my memory banks forever. The carpet was burnt orange. It was god awful. The tables were this brown, 1984 style thing, and she was beautiful. I remember what she smelled like, and her husband's right there, and he was awesome. The whole thing. And I could breathe. So we got hooked on this chiropractic thing really quick. And I drove down there. My parents drove me down there every day after school. I was doing 2 allergy shots a week on top of all these medications. That went away. All these medications went away that month, I think. I don't remember ever taking them again. And my kidney started to regenerate. Today, at 53 years old, it is 100%. And back then, it was half the size of my right one. So I don't care what people have told you. You hear people say, "Well, go to the chiropractor. They're just going to hurt you, or it's a placebo, or whatever." I don't care what they say. I've lived through this. I know the power of the body because I experienced it. If you're dealing with anything like that, if you have breathing problems, you need to get in and see us. If you know somebody that's having breathing problems, you need to bring them in. If you don't live here, reach out to us through drhooten.com, frontdesk.hootenfamily@gmail.com. You find us on Instagram. We'll help you find somebody out there. We know all the good ones, meaning the ones that will sit you down and put you on a program to get you well, versus somebody that'll do some type of therapy just to cover up the symptom because insurance pays for it. That insurance care doesn't work. It's terrible. You got to get into a proactive program, but I'm breathing better. All those drugs went away. That disease is gone. They baffled the doctors. We fired the system way long time ago. I mean, I was in the middle of it, taking all these drugs. Heck, my uncle, God love him, was my pharmacist providing all the medication. We have a neurosurgeon in the family, but nobody talking about the health of my spine. So if you got asthma, breathing problems, reach out to us. And the other thing is I want to touch on cholesterol and joint problems. Those go hand in hand. Do you know how?
No.
Okay, I'll connect the dots for you. Forever and a day, cholesterol has been the #1 prescribed drug in terms of how many prescriptions are written. The #1 moneymaker, so not the most prescribed drug, but the drug that makes the most money, $30 billion a year, is one for rheumatoid arthritis, a lot of joint pain. So you got cholesterol as the #1 prescribed drug, Number one moneymaker drug is for joint pain. The side effects of cholesterol drugs include joint pain. You see where I'm going with this? And it's both sides of the aisle. It doesn't matter what political party you're on. So many people are taking cholesterol drugs, headed towards this disaster. The side effects of cholesterol drugs don't just include joint pain. They include brain deterioration. They include testosterone reduction, libido, who wants to keep their libido up. You got to get away from these things. So fun times with the good future Dr. Bryce Maxwell, who has some questions for me. So introduce the question, how you're going to ask it, and then let's fire away, see what happens.
Okay, I am going to be acting as a medical doctor. I have a patient that is wanting to see you, but I think you're full of crap.
Okay, so you're the medical doctor.
Yes.
What do you say? So the patient says what to you, and what do you tell them?
Okay, so the patient says, hey, I saw this thing online that a chiropractor could help with my cancer, and I'm the physician, and I'm going like, there's absolutely no way. And now I'm coming to you because my patient is requesting you.
Okay, so the doctor's coming to me himself.
Yes, or I'm calling you.
Okay, so the doctor calls me.
Yes.
And so Christine answers the phone.
Yes.
Hooten Family Healing Center, this is Christine, I can help you.
Yes, I am a physician here at Baylor Medical Center, and I wanted to speak to Dr. Hooten because the patient is requesting him.
Okay, well, we're going to need to talk to the patient. So can you sign this consent form?
Yeah.
Or have the patient sign the consent form?
Boom.
Here you go.
Done.
Okay? So you get it back. Now we've got the consent form, so the patient says, yeah, you can talk to him.
Okay.
Okay, now, so we call up, and Christine answers the phone. Hooten Family Healing Center, this is Christine, I can help you.
Yeah, this is Dr. Brad. We got all the consents done, so I'm going to talk to Hooten now.
What did you want to talk to him about?
I just wanted to talk to him and see how he's going to help my patient with this condition and how he's going to go about it, because I'm concerned with her health.
Oh, well, I can help you.
Okay. So this is Christine still.
This is still my staff. She's not going to put me on the phone with him.
Well, I really want to talk to Dr. Hooten because he's the one
I'm the guard
that's
dog. You got to go through me first.
Okay, so how in the world can a chiropractic manipulation where you're torquing somebody's neck out help my patient with their cancer when they're already under care? They're stage 4, they've got too much to live, and she's watching some crazy video online thinking that you're going to help her with her cancer.
Well, Doc, it's really simple. Your brain is trying, or your patient's brain, our patient's brain, now because she's been here, is trying to fix her. It doesn't stop. So would you agree that the brain is up there working?
The brain is working, but the cells are mutating. This
Fair
isn't
enough.
a matter of the brain, it's a matter of cells, and we have to get them out.
So what I'm telling you is that when we adjust somebody, their brain gets to their body better. And that's it. We're not treating cancer. I think that's probably where you're mistaking. You're thinking she's coming to us for us to treat the cancer. And that couldn't be further from the truth. So if you got that impression, I don't know who gave you that impression. I know she didn't tell you that. But people come in here and they get healthier. And that's where we stop. Do people come in and their cancer goes away? Of course. Have we had some people come in when it's too late? Sadly, yes. But all we're doing is trying to help them get healthier. So if you can lower the tone a little bit and come in and see us, he'll show you, I'll show you. I can walk you through. My kid got his hearing back from getting adjusted. So we know how this works. If you can tone it down a little bit, we'll be glad to talk to you, but come in and see us.
Sure.
Sadly, that's never going to happen. The one time, I've had 2 doctors call me over the years, and it wasn't anything that nice. It was them yelling at my staff.
Yeah.
So one time it was so egregious, I got on the phone, I picked the phone out of the lady that was running the office back then. I picked the phone up, and he was still yelling, drunk. So we used to have evening shifts. We would be here till 7 or 8, and this guy had gone home or gone to happy hour or whatever. You could even hear the whiskey glass and all the ice cubes and everything, and he was slurring his speech and just cussing this and that. They have no idea. So you're asking that question. So chiropractic students, I would love for you to get this particular episode and share with chiropractic. Mm-hmm. That is such a one-off question. It is never going to happen.
Yeah.
You want to train on it because what's more likely to happen is the patient come in and say, my doctor said, don't come and see you, I want to quit care. this is a very tough pill to swallow. If they have made up their mind, if they say, I want to stop care, there is nothing you can do. People are going to do what they want. And if they've made up their mind and you try to change it right then, you're, in our faith-filled world, we're trying to be God. We're trying to be the Holy Spirit right then. They've already made up their mind.
Yeah.
So it's a hard thing to do, but you say, look, I'm here when you're ready to get healthy, and give them a hug, because they're obviously miserable and they're hurting or whatever. But even that's rare. So more often what happens is, so be the patient,
Okay.
and you're not quitting care.
All right.
And this happens, I would say, regularly. And you're laying on the table, I'm coming around to adjust you, and you're the patient. Now tell me that.
Tell you what.
So be the patient that the doctor said, don't go to the chiropractor or whatever.
Oh, yeah. Hey, doc, my doctor, I just got back from my doctor's appointment, and they say you're crazy and I shouldn't even be seeing you for what I'm going through.
So yeah, you know what, Doris, I hear that all the time. And the reality is they have no idea what they're talking about. So usually that'll stop them, but then I'll continue. Because you want to help further their understanding. I'll say, look, has the doctor taken a look at your spine at all?
No.
No, never looked at it. You saw your spine.
Yeah, I did.
And you know what's happening there. You know what we're doing when you get adjusted. And how are you feeling, by the way?
Feeling better.
Yeah.
Yeah.
So who's fixing you?
You say you, but they would probably say
They
you.
say me.
Yeah.
I say, no, your body's fixing
Right.
itself. So stay in that zone. You're going to hear all kinds of crazy crap out there. From family members, from doctors, what other, practitioners of any kind. But just, the truth. And if you can get them here, I'll explain it. Okay, let's go to the next question.
Yeah. Okay, so we've got such a wide range of chiropractors in the world. You say what chiropractor is, nobody knows what a chiropractor is nowadays, because is it stem, is it cryotherapy, is it flexion distraction, or my chiropractor massaged me, he was with me for 3 hours sort of deal. What is a chiropractor? So what I want to ask you is, what's the most common misconception that you get? Because obviously you're a flow doctor, you understand the body very well. It's not a symptom base, it's a cause base. So what are you most often getting from patients from previous experience with chiropractors of coming to you and expecting something?
Yeah, so all those other things eventually fail.
Right.
So thankfully, they'll still keep trying, or they'll see something on Instagram and come in here. Because a lot of chiropractors, don't talk like we do. So you have cancer, come and see us.
Right.
I'm not treating the cancer. You got blood pressure, you got rheumatoid, you got this incurable thing, come and see us. We'll walk you through it. So just in the upfront language. And then when they get here, most of the time they'll say, my other chiropractor never took x-rays.
Yeah, it's wild.
Or I have a friend of mine who was in a bad car crash, and the attorney said, go see our chiropractor. So he calls me, said, my attorney says, I have to go see this guy. And I said, did you already go? And he goes, yeah, I went one time. I said, what did they do? He goes, they put me on 3 machines for 15 minutes each, and then he rubbed my neck for 3 minutes.
Yeah.
I said, he didn't even adjust you? And he goes, no. I said, did they x-ray? And he goes, yeah, they're sending me for an MRI and everything, but he didn't show me.
Yeah.
So they gave him a shoulder rub
Yeah.
and 3 different machines and billed his insurance $300.
Yep. There you go.
So when you explain it right up front, where, look, our job is to get your spine flowing and coach you on the other parts, but the adjustment is what it is. And that is the biggest thing you can do. And it only takes 30 seconds to a minute.
Right.
And if they're having other issues and they need help with something, of course we'll talk to them, and we make time to talk to them.
Sure.
But focus on the adjustment first, and that is the biggest difference. And it's funny, the pendulum has swung so far. So
It's good.
there's so many people doing that garbage, stem cell injections and different therapies or whatever. We've become the oddity where we're actually the only ones really adjusting.
Yeah.
So the market is sort of sorting itself out, and people are swinging back over here. And there's offices closing left and right. There was I met a student when he was about as far along in his school as you are, and he came through our system. got into all this testosterone injections actually in his office. He brought a nurse in, and he's doing all this stuff. So he started traveling, and he lost everything. He's bankrupt and everything. He lost his wife. I mean, it's just a big mess. You can't. It's just like any other industry. You get all this money thrown at it, and people start gravitating towards where the most amount of money is for the least amount of work. Well, I want the most amount of miracles around me, the most happy, positive people, period. And then we'll let the money take care of itself. And we're not dealing with insurance. We're not dealing with any of that crap. So our fees are a lot less than anybody else's. And people get well. That's the best part. Now, I love it so much. I think that's another thing. When you graduate and you get into this, it's so fun. Like there's not, like you could, if my wife was sitting right here, she would say, yeah, he's never complained about going to the office. Like he doesn't wake up thinking, oh, I don't want to go to work. No, it is like out the door, boom, hit this place. You see the people in the morning it's sun up to sundown. It's just awesome. So you'll love it.
Yeah. And that's what I love about this too. And it's sad, like the school program is designed to make you scared not to adjust. And that's the reality of it. It's Parker's best PT school. They're the next best PT school, honestly. So you have to
Most of the schools are.
Yeah, most of the schools are. Cleveland's pretty good. They're pretty philosophical based, but still, it's like they're trying to market themselves as like being this wide range thing when they're losing what we started on.
The core value.
Which is what you do here and what I'm going to do. Right.
That a boy. Well, we're real grateful and excited to see you grow up. Are you going to be local when you graduate?
Yeah, I'll still be here in the North Texas area, so I'll be around.
Oh, game on. Yeah. Okay, remember, good to see you guys. We'll talk to you next time. Remember, drugs are bad, God is great, and so are you.
Yep.